What do raw blood test reference ranges mean? Imagine your blood tests as a way for doctors to get a snapshot of what's happening inside your body. When it comes to rheumatoid arthritis, certain blood tests help spot signs of inflammation or immune activity. These tests have reference ranges, which are like standard benchmarks used to interpret your results. They tell your doctor whether your levels are within normal limits or if they suggest something unusual. One of the main tests for rheumatoid arthritis is the rheumatoid factor test. This measures the amount of rheumatoid factor in your blood, which is an antibody that can be elevated in autoimmune conditions. The typical reference range for rheumatoid factor is less than 20 units per milliliter or less than 15 to 18 international units per milliliter, depending on the lab. If your result falls below this, it is considered negative, meaning there's no significant rheumatoid factor detected. A negative result can be reassuring, but it does not completely rule out rheumatoid arthritis because some people with the disease may have normal rheumatoid factor levels. If your rheumatoid factor level is above the reference range, it is called a positive result. This indicates higher levels of rheumatoid factor, which can suggest autoimmune activity. However, a positive rheumatoid factor is not exclusive to rheumatoid arthritis. It can also be seen in other autoimmune diseases, chronic infections, and even in some healthy older adults. The higher the level, the more likely it is that an autoimmune process is involved, but doctors need to look at other tests and symptoms to make a clear diagnosis. Another important test is the anticyclic citrullinated peptide antibody test. This test is more specific for rheumatoid arthritis. A positive anti-CCP result strongly supports the diagnosis, especially when combined with symptoms and other test findings. In addition, doctors often check inflammatory markers like C-reactive protein and erythrocyte sedimentation rate. Normal C-reactive protein levels are usually less than 10 milligrams per liter, and normal erythrocyte sedimentation rate values depend on age and sex. Elevated levels of these markers indicate inflammation, which can be caused by rheumatoid arthritis or other conditions. Remember, blood test reference ranges are just one piece of the puzzle. Your healthcare provider will consider your symptoms, physical exam, and other tests before making a diagnosis. No single blood test can definitively confirm or rule out rheumatoid arthritis. Always discuss your results with your doctor to understand what they mean for your health. If you have concerns or symptoms, seek personalized advice from a healthcare professional.